So Angel, how are you feeling this morning?
I'm feeling fine and nice.
So ready to go back to Nigeria?
Yes, any moment from now.
Any moment.
Yeah, I'm ready to go back to Nigeria.
And now you are able to do all activities on your own?
Yes, every activity, bathe myself, take care of myself on my own.
And how's your pain?
My pain is well reduced.
Very reduced.
Yes.
So at about 3:30 we have appointment with Dr. Mukta Kapila. So we go to her at Artemis Hospital, ask all the questions that you have in mind, what you can do, what you can't do, for how much time, and if there's any problem, then the doctor would always be available on the phone.
Okay.
So Emmanuel, how about you? How are you feeling about your decision of coming to India?
Well, it was a wonderful decision. It's been nice. I came out here and then she was taken care of excellently. So it was a very good decision, and I think I'm very, very happy about that.
But you've not been able to spare any time to see any of the beautiful things of India.
Yeah, because actually we do not have much time into that, but I know I'm going to be back here by next year, and then definitely have to take a vacation, look around, go to Bombay, go to Goa, any of the other places.
And you'll be coming along with Angel for vacation?
Yeah, definitely I will.
Okay.
Yeah.
Okay, Emmanuel, you gave us a call in about the end of September, and you asked me whether we can get a better rate than this. So what prompted you to stick to that particular rate which we've given to you and not take a lower quote? I told you you can get this surgery done in India for even $2,000 as compared to the $4,200 which you paid for Artemis.
Yeah, actually, when I called and you told me that I can get it lower than what you told me, and then all the same, you made me understand that it depends on the quality of thing I want. You understand? If it's like going to every other place, if you want something lower, you can get it. If you want something higher, but it depends on the quality. So I think I felt convinced that if I come to Artemis and then what you told me about the place, and I have to do some research on the internet too, I realized that I could get better quality for the health of my wife, which was more important to me than how much I was going to spend. Right? And I was impressed.
So do you feel justified about the cost, or do you think you could have got this kind of treatment at some of the top hospital in Nigeria by spending this amount of money? And of course it includes the hospital cost and also the flight cost.
Yeah, but the thing is this, there's no comparison between the kind of services and the hospital and the quality of healthcare here in India and Nigeria. I've been living in the United States for a long time, and then it's so similar. I mean, there was no difference between the hospitals, the kind of healthcare I got here. You can't compare it to Nigeria, because actually there, most of the doctors there are more interested in the money they're going to get from the patients than the quality of healthcare they're going to give to them. So there's no comparison one way, right?
Okay, now, tell me about, because we were talking and the doctor earlier told us that it would be a 3-hour long surgery. Of course, she told us it's a very, very difficult and complicated surgery. And then when the surgery was going on and on and on, how were you feeling waiting outside the operating room?
So much anxiety, I'm telling you honestly, for real. Initially, the doctor said it was going to be 2.5 hour to 3 hour surgery. Then I looked at the time, it was about TikTok, about 3 hours, 30 minutes, 4 hours. I felt so scared. I was scared. So much anxiety in me. But I called you and you made me understand that as long as Dr. Kapila is the one taking care of the surgery, everything is going to be all right. And at the end of after about 5 hours, when the surgery was over, she sent for me, and I saw her and she told me I should be smiling. As much as it was a very serious and complicated surgery, but my wife is okay, and I was very, very happy about that.
And how did you feel when you saw Angel for the first time post-surgery?
I had smiles all over my face, man. I had so much smiles. I I would have felt so bad if I had lost her, and I thank God for that, you know. So.
And Angel, how did you feel once you saw Emmanuel, you know, when you came back to the consciousness?
I felt, wow, I came back to my husband at last.
So, do you remember anything about the surgery? When they wheeled you in, or any anxieties at that point of time?
No, I don't remember anything.
You don't remember?
It was just a mere sleeping, not even a fast sleeping, you know. I was just within just quiet sleeping. At last, I just saw myself.
So now you are confident of, you know, you're rid of all the problems that you used to face. So now are you looking forward to a very, very happy and exciting life?
Yes, I am.
She's
I am.
happy all day long. Since after the surgery, that was the best thing that has ever happened to her. You know,
Yeah.
so, and I think coming to India has been one of the best things that has ever happened for us. You know.
So Emmanuel, you contacted Health in India. What, you know, made you go ahead with, you got the first answer from Rahul on your BlackBerry. What was that clinching thing? You told us that, you know, 4 or 5 other people were also calling you up again and again. So what was it that you thought that you'll go ahead with Health in India?
Yeah, the thing is this. The response was immediate. I sent an email to them, and then 20 minutes or thereabout, I got a response back, and then I sent certain questions to them, and then they replied me back immediately. And other people were thinking about a day or two, and then one way or the other, I had confidence in, health in India. They were telling me a lot of things that I could get these things cheaper, but due to what I want, and if I really want quality, that I should go ahead with them. So they gave me so much confidence, and I had to stick with them. And there's no regret to that up till now. I'm still so happy about it.
So would you feel confident to recommend India and of course our company Health in India as the destination for getting treated?
Definitely I would. With the experience I've had here, at times the thing is, once you've gone, you've seen. I think I've gone, I've seen, and I've conquered. So definitely I would be very, very happy to recommend Health in India to anybody at all.
Angel, when I last talked to you at the hospital bed, you said nothing is perfect, but you still give 98% marks. I would want you to frankly let us know, what more could be done to make things better, maybe to cover up that 2%.
No. I said only God, when you say God is 100%. Everything, you don't give everything 100% mark. That is why I reserved the 2%.
Emmanuel, you have been a US citizen, seen all, spent 1 year at Johns Hopkins. You must be having some observations for improvement. Could you point out some things which are missing in the Indian healthcare or in your entire trip? Some observations, some critical observations to improve things.
Yeah, I'm trying to think. I spent in 2008, I had a spinal cord injury. I was at Johns Hopkins in Baltimore for 9 months to 12 months away, and I went around the hospital. At least once I get into the hospital, I know how the hospital building is, like the nurses, the doctors, and all whatnot. And when I got into Artemis, there was just no difference, nothing at all. It's as if I'm in a hospital in the US. I mean, I couldn't imagine such technologies and everything being here in India. Because everybody saying, hey, Western world, that's the United States. I mean, with what I saw here, I don't think there's in as much as maybe the nurses need to really be more cautious, right? But the doctors are wonderful. You understand? The doctors are wonderful, and the nurses too are good. Everybody's smiling. They are taking care of you, and they are smiling, and you don't have any cause for you not to smile back at them, because they are giving you a wonderful service. And the prices are okay compared to the United States, because the insurance, you got to have an insurance. I knew how much the state of Maryland spent for my surgery and everything compared to what I spent for my wife's surgery. So the prices are very, very moderate, which every person can afford. So the service we got here has been very, very good.
But I think, you know, from the last 10 days of experience, maybe you'd like to give a lesson or two to the Indian chefs how to cook the non-veg food, and what do you mean when you say spicy?
Yeah, that's just the only thing. The food is maybe coming from a different culture over here, but the Indian food is so full of, it's so spicy, curry, thyme and all whatnot. So most of the time we have to go look for McDonald's or look for KFC or something like that. We are used to the African food in Nigeria or the food in the United States. But apart from that, man, I didn't come here to come and eat food. I came here for my wife's sake, and that one alone made me feel good. You understand? I could hang on to every other thing, but that one alone, it's okay by me.
You know, maybe we can teach the Indian chefs that when the Nigerians say chili, the spicy, it means only chili spicy and not the whole lot.
Not the whole lot, not the
spices
whole and everything. Spicy like
And the local pepper soup spice. We saw one local pepper soup spice in our house last time.
For real, it's been nice though. The food, they are coming up gradually, and even the people here in the hotel, most of the time we tell them what we want, and then we try to prepare it the way we want. You understand? So it's a different culture, but with time, everything, you know, it takes time. With time, everything will be sorted out.
And
so Angel, how are you doing?
I'm fine. I'm very, very fine.
All ready to go back to Nigeria?
Yeah, very
Okay.
ready to go back to Nigeria.
Great. We are very good to see you.
Thank you very much.
So you just lie down. We'll just remove the stitches.
Okay.
Call the system.
Yeah.
So Angel, you're feeling fine now?
Yeah, feeling better. I'm okay, very fine.
So I've removed your stitches.
Yeah, you just removed the stitches and little pain just because it's my skin, but I'm okay. I'm better.
Yeah. So now you'll feel absolutely okay.
Yes.
So you're flying back day after tomorrow.
Yes. To Nigeria.
Great.
How are you feeling? You're flying back just after 10 days?
Wonderful. Wonderful. Nice feeling, but it's okay. And I know I'm healthy to fly.
You knew it was going to a big surgery?
Yes, I knew it was a big surgery because I've done it twice in Nigeria. And the third one is so scary. That's why we need to go somewhere as in to get more professional hands for it.
So how do you feel this time?
I feel very light.
Better than earlier?
Yes, better than earlier. Very, very light. Better than what I've been feeling for years.
Great. You know, you had such a big tumor, and the tumor was pressing upon your bladder, pressing upon your intestine. Everything is now out, and you'll feel very, very good, very light.
Yes.
And you can join back work immediately.
Okay.
You don't have to take much of rest. Just look after yourself, look after your diet,
Okay.
and you can start work with few hours initially, and then step up and you can start working.
Okay. It's alright.
Right?
Yes, thank you very much.
How did you feel throughout the stay? How was your stay?
I can't really tell, I can't, as in, words cannot really explain it, but I feel very good and nice.
You're comfortable?
Yes, comfortable. New life again.
Okay, you feel like that you got a new life again.
Yes.
Hello.
Good. Take care of yourself.
Okay.
You need to see somebody.
Yes, sir?
No, not now. Maybe 2-3 weeks later. You have already explained the precautions and all that you have to take.
Yeah.
So you can see somebody locally there.
Okay.
You'll be fine, you won't have any problem. But we normally like to see the patient after 3 weeks or 4 weeks.
Okay.
Just go to a local gynecologist there after 4 weeks, and you can be in touch with us on our mail,
Okay.
and we'll give you the mail ID.
Okay.
And if was absolutely a delight to have you, and I'm so happy you are going back absolutely healthy and fine.